Hi, this should be day 6 unless we've changed the syllabus a little bit. And I'm going to talk a bit about your allergic response. Hypersensitivity basically means that you're having an excessive response. You're supposed to have an allergic response to something that is bad. You're supposed to have an immune response. But the basic concept of an allergy is it's something that shouldn't really bother you that much, but it bothers you a lot. So you have an over-response of some kind to an antigen, a pathogen. So hypersensitivity, an altered immunological response to an antigen. It is an antigen. It's something coming in from the outside, but it's not something that is necessarily harmful. Breathing in ragweed pollen doesn't like eat your cells or spread within your body or anything like that, but it's got an antigen on it that will cause you to maybe sneeze and blow the top of your head off. So an allergy is this hypersensitive response to something. Peanuts, ragweed, politicians. Autoimmunity means that you're attacking your own cells because you, for some reason, recognize your own antigens as being foreign. Alloimmunity means you're responding to something from another person. An allograft is for instance, a ligament that's taken out of a cadaver and put in your knee to help reconstruct your knee. So an alloimmunity is like a response to a blood transfusion, a heart transplant, something of that nature. We can have immediate hypersensitivity reactions, such as if I breathe in a pollen that I'm allergic to, I will sneeze right now. I can have a response that is within a second or two. A delayed response is it takes a little while for my body to recognize the problem. For instance, allergic reaction to penicillin. If somebody's given penicillin, they're likely to go home and then get sick a couple of hours later. And anaphylaxis is a super overreaction. People have it to bee stings, they have it to peanuts, they have it to latex gloves, and it is such an amazing response that it can close the airways up completely and kill you. Here's an anaphylactic reaction. And remember, IgE, allergic response. Eosinophils, release of histamines from mast cells. Eosinophils, in combination with IgE, cause mast cells to release their substances. Histamine, and also slow reactive substance of anaphylaxis. Terrible name for a substance that is like histamine on steroids. It's even more powerful than that. Vasodilation, it can send you into shock because your blood pressure drops so much. Bronchoconstriction, because histamine constricts bronchi, presumably to keep you from breathing any more bad stuff in, but if it's an over-response, you suffocate. Swelling up of hands, feet, face, lips. This person probably doesn't normally look like that. Couple different kinds of allergic response. A type 1 allergic response is that immediate response to an allergen, coughing, sneezing, swelling up, can be anaphylaxis, an asthmatic type of response to breathing in even really cold air. A slower type would be antibody dependent. Type 2, you're required to respond to it. Dendritic cells take the signal to the B cells mature, they make the antibody, now suddenly you're able to actually respond to it. So it takes a while to have that kind of response. erythroblastosis fetalis, that Rh-positive fetus, second of a Rh-negative mother. She attacks the fetus because it has that Rh factor that she doesn't have. So it's a longer-term effect. Soluble antigens that come off of the invader or come off of your own cells, and your immune system recognizes them as bad guys, and they are floating around in there. They don't go away. Chronic inflammation, rheumatoid arthritis, those types of conditions. Delayed hypersensitivity, you detect an antigen, you make antibodies, and then the macrophage response itself causes an allergic reaction. These can be things like a transplant rejection. And true autoimmune disease, where your immune system becomes morphed. Either your immune system becomes changed to recognize your body as foreign, or your body changes the antigens on its cells and your immune system starts attacking it. Myasthenia gravis, Graves' disease. This is hyperthyroidism, where you're attacking your own tissues. Basic manifestations, especially for type 1 hypersensitivity: itching, sneezing, coughing, runny nose, hives, urticaria, break out of a skin rash all over you, conjunctivitis, inflammation of the eye, the tissue that surrounds the eyeball that has all the blood vessels in it, drop in blood pressure, bronchospasm causing asthmatic type symptoms. You can have heart arrhythmias from it. GI cramping. So if you eat gluten and you're gluten sensitive, suddenly you swell up in the GI tract and you can't absorb nutrients anymore. Fairly rapid thing. Tends to be tissue specific. So the antigen that, it's in the GI tract, it is the duodenum. It is the nose. It is the lungs. You can, to find out you have these, if you think you're allergic to something, you can try eating a little bit of it. You can put a pinprick and put a little bit of it on your skin and see if it pops up. Laboratory tests. I had a blood test done. I have allergies every spring to a couple of different kinds of pollens and things. So I had a blood test. They're better nowadays. They're almost as good as the skin test for determining what you're allergic to. And one thing you can do to try, you can just take a bunch of Benadryl. You can take other antihistamines, anti-leukotrienes, or you can try, over time, desensitization, where you are exposed to tiny amounts and gradually increasing amounts so that your body gets used to it and won't respond to it so dramatically. You have to be careful, though, because if you're allergic to it, you can't suddenly take a lot of it and hope for the best. One way people try to desensitize to pollens is eating honey that was made from the plants who produce the pollen that you're allergic to. So you eat little bits of honey from flowers of the ragweed. Type 1 sensitivity. The antigen presenting cell is exposed to a B cell that becomes a plasma cell now with the help of a helper cell. See, this is kind of a good review of what we did before. The plasma cell makes IgE, which is going to stimulate the mast cells to degranulate and release histamine. And one reason allergies have a tendency to get worse over time, oh gee, I never used to be bothered by this so much, and now it bothers me a lot. If you do this a few times, you start making memory cells, memory plasma cells. It's kind of like you have vaccinated yourself. So now the next time you see it, you're already ready to start releasing a whole bunch of histamine. So it's not uncommon for people to have allergies get worse over the course of their lives. They get better at responding inappropriately. So allergies are usually type 1s. You're exposed to it, you swell up, you sneeze, you cough. Atypical responses. And these are, it's a genetic predisposition. It's just something you can't help. And if you're sensitive to ragweed, it's just because your immune system is designed to be sensitive to ragweed. Animals, I'm allergic to cats, and we have 4 of them. But they're so fuzzy, I can't help myself. Bee stings, wasp stings. Bee stings even more than other types of animal stings, though. Another comment on autoimmunity. Somehow your body, which doesn't see your own antigens because that's what you're supposed to have and therefore it doesn't look foreign, suddenly decides it's foreign. Now that cell that holds the antigen could have been infected by a virus that changed the antigen just enough that it really is different. Your immune system could have been affected by a virus and changed its predisposition enough that now suddenly it's seeing some of your own tissues as foreign tissues. And some infectious diseases, even bacterial diseases, but especially viral diseases, will induce this because they change your own cells enough that they look foreign. Antigenic mimicry. The virus produces substances that look like antigens to your immune system. SLA, lupus, is one of the most commonly understood. I mean, we're not good at treating it. We're really not very good at treating autoimmune diseases. You take a lot of immunosuppressants and steroids to suppress your immune system. Well, that's all well and good. Then you don't fight yourself, but you also don't fight off other diseases as well either. So you're more likely to get some other disease that normally you could fight off. Your autoantibodies, creating antibodies that will attach to your own red blood cells, some of your lymphocytes, your platelets, and once an antibody is attached, then your own immune system will attack it because that's what antibodies do. Lupus is it's really more of a syndrome. I mean, it is an autoimmune disorder, and so you attack all kinds of tissues within your body, but it has so many different things going on that it's more like a syndrome than a disease. Arthralgia means pain in the joints. Arthritis means inflammation of the joints. You tend to attack your own synovial capsules and your own synovial fluid. Vasculitis and rashes, swelling and inflammation of the skin, kidney disease, blood changes attacking your own blood cells, and cardiovascular diseases. All of these are involved in lupus. A lot of these different things. This is the discoid rash. It has like disc-shaped blobs all over. It looks like urticaria. Urticaria has these raised wheels, W-H-E-A-L, they call them, that looks like, and it will come and go and come and go. So this type of a rash, photosensitivity, you're sensitive to light, ulcers in the nose and the mouth, blood disorders, neurological disorders, tingling, burning, pain. And if you have 4 of these, when they say serial, they mean one right after the other, or at the same time, it's a diagnosis of lupus. So there's not a single, you can't go in and take a blood sample and say this person has lupus. You have lupus if you have at least 4 of these guys going on at the same time. Alloimmunity, again, is a rejection or an allergic response to a foreign tissue, a heart transplant, a kidney transplant, a skin graft from somebody else other than yourself. Transplant rejections, transfusions. If you get an A type A and you're a type B, you're going to fight against that A antigen on that A blood. Or RH, if you are an RH negative and you get an RH positive blood, there's an antigen that's not yours and you're going to fight against it. Graft rejections. Now, if somebody is burned so badly they don't really have any skin to use for their own skin grafts, and they may have to take skin from somebody else and take anti-rejection drugs the best they can. Hyperacute means as soon as you put it on, it's like a type 1 sensitivity, and you immediately have an immune allergic response. That's pretty rare because normally for you to respond, you have to recognize an antigen, go and stimulate your B cells to become plasma cells and release the antibody, and so forth. So normally rejections take weeks to months before they happen. Acute is going to happen pretty soon. It's happening right now. Chronic could happen even years later. And this is a very unusual condition, but it can happen. You get a graft, you get a heart from somebody, and its cells start attacking you. Normally, there's not enough immune system inside a piece of skin or even in a heart or a kidney, but maybe a section of intestine because there's a lot of immune cells in there. But here's where if you are immunocompromised, if your immune system is so weak that it can't fight very well, that grafted tissue may attack you instead of you attacking it. Real quickie, and we'll have 2 lectures for today.